Okay, are we live? Hey guys, this is Bobby Clue with the Somerset-Pulaski County Chamber of Commerce. We are back at it again for another one of our virtual ribbon cuttings. Out and about today in the MedPark Medical Complex here. It's very well known right here kind of behind the hospital. We've been over here to do many events over the years, and I'm here with Dr. Don Brown, Southern Kentucky Vascular. Dr. Brown, thank you very much for taking the time to talk with us a little bit today.
Well, thanks for coming. I really appreciate it. We're excited.
So tell us a little bit about Southern Kentucky Vascular and maybe your origin story. I love a good origin story. How did you get here? Bring us up to speed on what you guys are doing and how you got to Somerset.
So I was in Bowling Green practicing vascular surgery for a long time, 19 years, and I decided to go to South Dakota for a minute and become private practice physician, but I really missed Kentucky. And I missed being closer to my kids, and so I wanted to find a way to get back here. So I reached out to the hospital, and they were very, very open to me coming to town and starting a private practice, and so here we are.
So by talking with the hospital, so you are, and this is just my ignorance in healthcare, you're a separate entity from the hospital, yeah, but you all refer business. They refer business to you. How does that work?
I'm an independent. We have no formal relationship, but I consider them a partner and,
sure,
and an ally and a friend. And I take care of patients in the hospital often.
Sure.
In fact, every week. And so
I believe that.
But we do a lot of work in the outpatient setting as well.
Gotcha. So Robert Parker's on our board of directors,
yeah,
and I think they're a top-notch group of guys over
sure
there, and it's great to see them, forming these partnerships with, really top-notch doctors and recruiting them and having them in the area. I always have perceived Pulaski County to be a bit of a medical hub. I always tell people when you have multiple dermatologists and you have these specialties and ENT, vascular, you have some of these different people, it really is a huge draw, and it helps us recruit people, businesses to this community, because people want those services. They want them close where they don't have to travel several hours to get them. And having this here is just, in my opinion, having you here is just another tool in the belt. So that's great to have you here.
Yeah, they haven't had a vascular surgeon here in about 5 years. And there's just a huge need in the area. And so we're very blessed and privileged to be here to take care of patients.
Well, that's wonderful, and I would love if we have an opportunity. So, frame of reference. So the best ones I can give you for MedPark, Advanced Care Pharmacy, our friends over there, the Dungans, they're literally across the street from you guys. I saw you had an office over there as well. So you have two offices here in the complex, it looks like?
We're at 50 MedPark Square Drive Suite 3 right now, and this is our new clinic. We opened it up in June.
Okay.
And that's what we're celebrating today. But right next to us in Suite 2, there's some shelf space right now, but our hope is in the next several months to have our outpatient procedure center finished and working there. In the meantime, over the last year, in 25 MedPark Square Drive Suite 3, which is right next to the rotating specialty clinic, we do outpatient simple procedures. We do vein procedures, we do angiograms. And I say simple, but some of them aren't so simple, but they're safe.
Right.
And the patients love an outpatient experience. We have just top-notch staff, and they really give a lot of love into the patients, and the
Sure.
patients really feel good about their experience.
Well, there's probably something to be said about your mental well-being. I know that, if you think you have to go to the hospital a lot of times, that's a real stressful place that some people go to. And if you can have maybe a procedure with you in a more comfortable environment as opposed to having to go there, I'm sure that's good all the way around. And I'm sure that's easier for you a lot of times as well.
Yes, sir. That's exactly right.
Because it's your place. You've put everything where you want it. It's your things, and
right.
I'm sure that's quite nice as well. Dr. Brown, could we go inside? Could we take a look?
Well, I'd love to.
I know you've got a huge staff in here, and I'd love to just maybe go in and check things out, walk around a little bit.
Yeah. So here's the lobby, and this is
beautiful.
Thank you. Yeah, we wanted maybe not like a spa-like presence, but closer, like a little upscale. And so we're really proud of it. This is Diana Williamson. She's my
Diana,
nurse
how are you?
practitioner.
Hi, nice to meet you.
Good to see you, Diana.
And so she's somebody that the patients will see maybe as much or more than me.
Diana is the one that's she's got boots on the ground, and she's taking those calls, and she's making sure everybody's taken care of.
Yeah, she's
I know
great.
how this works. She takes care of everybody until it's time to do some the big stuff, and then you come in and do that. I know how this works.
And she's well known in the community because she practiced in Nancy for 20 years.
Where at? Out in Nancy.
Nancy Family Practice.
Okay. Well, I grew up in Nancy many
Down 80.
many moons ago. I know exactly where that's at. Well, that's great. Well, that's a fantastic pickup for you, I'm sure.
Yeah, it is, no doubt about it.
So this is, how new is this space that we're in right here?
Well, we just started seeing patients the beginning of June.
Oh, wow. Very new.
Yeah.
It's beautiful. It doesn't remind me of a doctor's office in any capacity. It's very nice. I mean, even the ceiling is beautiful, so it's very well done.
We love this. The Deco architects, they really helped us with this. And I'm going to give a shout out to Ryan right now. He had this idea of a tree sort of thing. Also kind of has a vein and an artery vibe as well.
It's they're great. Deco helped us with our renovation in our office actually in downtown when we moved from 27 to downtown Somerset, and they did a lot of work for us. And we always joked. We said we better get them while they're cheap, because they're not going to be cheap very long. They're very talented.
Yeah, it's too late. They're not.
Well, I'd love it if we could just kind of see the facilities and talk about, maybe you could talk a little bit about, Dr. Brown, maybe some of the procedures and some of the types of people that you see. So I know we talked a little bit earlier, my mother, before she passed, she was older. She was having vascular issues. I mean, I'm sure you see a lot of older people, but I'm sure the gambit runs pretty wide. What are some of the types of things that you see, some of the procedures that you do? Yeah,
so a typical vascular surgeon, and myself included, would take care of people's arteries and veins, not the heart and not the brain. So I did clean out people's carotid arteries, fix their aortic aneurysms, and we do some dialysis access, but Dr. Seatack is in town and does a wonderful job with that, so we really don't do a lot of that. We do some. But leg bypasses, and I guess the biggest majority of our care we give patients is treating their arteries with endovascular techniques. So needle stick type of stuff. We're able to get people that have ulcers, that have pain, that are just laying around, and we bring them in and we do an intervention and we get their blood flowing better, they feel better, and then we have a saying, like a tagline, we get them to walk on. Mm-hmm. So they go from, I have a vision in my head of somebody laying down and just kind of rising up and walking, and so that's kind of our goal. Then we also do a lot of venous work. So there's a lot of people out there with venous insufficiency. There hasn't been anybody in the region for a long time that does any venous work, and so we take care of people with swelling, varicose veins, staining, ulcers, that kind of thing as well.
That's what Mom had, and we traveled to Lexington quite a bit for her because there wasn't a vascular surgeon here. So it's great to have you in our community. It's very important, and I know a small part of what you do, and I know how it affects people's lives. When they can't walk and it's uncomfortable, and it's great to have you here and doing those procedures.
Well,
are we allowed?
Yeah, let's
to go
come on back.
here?
So if a patient experience, they would come in the lobby, and we have Haley at the front desk. We'll check him in. She's not here right now, but then we would come back here, and we have 2 full-time ultrasonographers, and they're wonderful and seasoned, and their specialty is vascular. So they come in here and take care of the patients and scan them. And then
this is a large space. It looks like you're going to have even more space. You said on the other side when you build that out long term.
It's about 2,800 square feet, I think. Sure. Mike Whitaker did just an amazing job leading us and directing us. We have taller ceilings, and I think that makes it feel bigger.
It's beautiful, and we all know and love Mike Whitaker. He's a former chamber president.
Yeah, I believe it.
Many years ago.
So there's a typical exam room. We have 4 of them. We put some pictures of some local areas. There's a bridge right there.
Love that.
It's not the big bridge, but it's one of the local bridges, yeah. And then we have a nurse's station back here. And again, a couple more exam rooms. And then we have a little bitty office for one of our ladies, Tanya. So if we have to have private conversations when there's hustle and bustle around here, we're able to close that door. We have a couple bathrooms. A lot of times you go in the doctor's office, you don't have access to a bathroom, but we have one in the lobby, and we have one back here as well.
You know, I know a lot of doctors that I talk with here in town. It seems like they're here 2 or 3 days a week, and they're somewhere else 2 or 3 days a week. Are you here? Is this full-time practice for you, or do you have other places that you have offices as well? How does that work?
So I am Somerset.
Okay.
So I live here. My wife and I moved here, and my kids are grown. They're in college, and they're out and about, so they come and visit often. But yeah, this is our main practice. I'm here 5 days a week as a practice. We do have, and so I'm here on Monday afternoons for my clinic, specifically here. But Diana has clinic 2 other days, and then half a day a week we do outreach clinics in London and in Danville.
Gotcha.
But if we were to see somebody in London or Danville right now anyway, if they had a procedure, they'd have to come back here, and that's probably the case for foreseeable future.
Well, and I think the magic word you said is, you live here, and I think that's kind of the things that people want to hear. The people that are going to watch this today, they want to get to know their doctor. They want to establish those relationships and have a friend. I know sometimes when you go out of town, sometimes you feel like just a number sometimes, but to have a local person who lives in this community, I think it's a big deal. And it's important that they get to know you, Dr. Brown, and that they make that connection that you're here, you live in this community. So that's fantastic.
I appreciate that.
Sure. So we got a little more?
Just a little more.
Okay.
We have a few offices for our OBL manager and my nurse practitioner and myself.
Sure.
And then,
such a well-designed office. It looks really good.
Thank you very much.
It's very modern. It looks nice.
And then here's my staff right here, staff and family.
Put them on the spot.
Yeah, and we're in the break room, and very lucky. Got the best staff in the region.
Well, that's fantastic. It's a beautiful office, and I think you would agree that you're only as good as the people you surround yourself with.
Yes, sir.
So it sounds like you've got a wonderful staff, some very talented people, and they're the ones that make us look good,
That's
so
right.
That's fantastic.
That's right.
Well, we could maybe go up front.
Sure.
And, one of the things I would ask you while we're just kind of walking and talking, how do people get a hold of you? If they think that they need to come see you, do they have to start that here? Do they go to the hospital first? Do they have their family practitioner make a referral? I don't know how any of that works. How do they get to you if they say, maybe I need vascular, maybe I don't even know. How do we find you?
Yeah, so the typical patient would go through their referring doc just to keep the referring doc in the loop, and that establishes, sort of a interaction between me and the referring doc and gives them feedback on their visit. But you don't have to have a referral. It's not like the old HMOs or PPOs where, if you just want to call our office, you can call and make an appointment, and we'll work it out with your doc. That phone number is 606-531-4100. You can also get on our website, which is southernkentuckyvascular.com.
Great. I think in this day and age, with the WebMD, and we all figure we have at least a 2-year degree in medicine all of a sudden because of that. So, I'm sure people might want to walk in and say, I know something's wrong. I don't know what it is. I'd like to start the process right here. And then somebody, like myself, I've got a local, Dr. Rodney Oakes has been my doctor forever. I'm sure if I went in there was anything wrong, the first phone call he might make is to you to set up an appointment. That's probably how it'll go for a lot of people. But everybody doesn't have a family physician. So maybe they just use an urgent treatment or something like that. Do they refer over this way? Or do you have to, what would they do if you don't have a family physician? How would you come over
Just call
here?
the office.
Just call the office
we'll
and work it out?
Yeah, for sure.
I kind of figured that would be the way to do it. And again, with you being here and having a lot of access, that's not an issue to call the office here and come in. So, again, we're over in the MedPark Medical Complex, Southern Kentucky Vascular. I'm here with Dr. Don Brown, and we're just kind of going through the nuts and bolts of what a vascular surgeon does more than anything. And it's pretty interesting stuff, in all honesty. This new beautiful office is why we're here today, to celebrate this. And what we're going to do now is we're going to go outside and we're going to do an in-person ribbon cutting. Is there anything I've forgotten, Dr. Brown?
No, I don't think so.
We covered a lot of ground there, didn't we? Guys, stay tuned. Next week, we're going to have another one of our virtual ribbon cuttings. Until then, be safe, and we'll talk to you soon. Thank you very much again, Dr. Brown. We appreciate it.